Namaste, myself Dr. Riva Gupta from JAYOTI VIDYAPEETH Women's University, Jaipur, Associate Professor in Department of KRIYA SHARIR, Faculty of Ayurveda Science. Today's session is about Cardiovascular System Part 3 for BMS first year students. Arterial pulse, it is defined as the pressure changes transmitted in the form of waves through the arterial wall and blood column from heart to the periphery. Ejection of blood in aorta causes distension of aorta and rise in pressure. A pressure wave is produced on arterial wall and travels rapidly from the heart to the periphery and can be felt at any superficial peripheral artery like radial artery at wrist. Transmission of pulse. The formation and transmission of pulse wave depends upon the elasticity of blood vessels. Velocity of transmission of pulse is 7 to 9 meter per second and velocity of blood flow is 50 centimeter per second. Pulse points means ऐसे points जहाँ पे हम pulse trace कर सकते हैं या easily जहाँ पे हमको pulse feel हो सकती है उन्हें हम pulse point कहते हैं. Temporal pulse over the temple in front of ear on superficial temporal artery. यहाँ पे जो ear के front पे यहाँ पे. Facial pulse on facial artery at the angle of jaw. यहाँ पे. Carotid pulse in the neck along the anterior border of sternocleidomastoid muscle on common carotid artery. जब हम ऐसे neck को side में turn करते हैं तो यहाँ पे carotid sternocleidomastoid muscle होती है उसके anterior border पे मिलेगा हमें carotid pulse. Axillary pulse in axilla or on axillary artery. Brachial pulse. Then radial pulse, ulnar pulse, femoral pulse, popliteal pulse, dorsalis pedis pulse, and tibialis pulse. Pulse tracing. Generally, in a pulse tracing, we can see 4 parts: anacrotic limb, catacrotic limb, catacrotic notch, and pre and post catacrotic wave. Anacrotic limb is ascending limb or upstroke or primary wave. It is due to increase in pressure during systole. Catacrotic limb, descending limb or downstroke due to fall in pressure during diastole. Catacrotic notch due to backflow of blood during closure of semilunar valve. Pre and post catacrotic wave, parts of catacrotic limb before and after the catacrotic notch. Examination of pulse. In examination of pulse, below characters should be noted. First is rate. Rate means number of pulse per minute. In fetus, it is 150 to 180 per minute. At birth, 130 to 140 per minute. At 10 years, 90 per minute. And at puberty, after puberty, 72 per minute. Rhythm means regularity of pulse. It may be regular or irregular. Irregular pulse may be regularly irregular or irregularly irregular. Character of pulse, it denotes the tension on vessel wall produced by waves of pulse. It becomes more prominent in subabnormal conditions such as anacrotic pulse, means slow ascending limb with anacrotic notch. Water hammer pulse means a rapid upstroke and rapid downstroke, etc. Volume, it is determination of the movement of the vessel wall produced by the transmission of pulse wave. Condition of the blood of the wall of blood vessel, it is determined by obstructing the blood flow at brachial artery and rolling the radial artery against the underlying bones. In old age, the wall of vessels become rigid and palpable. Delayed pulse, delay in arrival of pulse in certain peripheral arteries. These such conditions are femoral delay or radiofemoral delay or radial delay. Cardiac output. Cardiac output is the amount of blood pumped out by each ventricle during each beat, means stroke volume, or in 1 minute, means minute volume. When heart rate is 72 per minute, then normal stroke volume is 70 ml and minute volume is 5 liter per minute. Variations in cardiac output. Age, less in children because of less blood volume. Sex, less in females than males because of less blood volume. Body build, Greater body build has more cardiac output. Diurnal variations, low in early morning and increase in daytime. Increase in temperature raises cardiac output. High altitude. Hypoxia on high altitude causes increased cardiac output. Emotional conditions like anxiety, excitement increases cardiac output through the release of catecholamines. After meal, cardiac output increases. After exercise, cardiac output increases because of increase in heart rate and force of contraction. During sleep, cardiac output slightly decreases or remains unaltered. Cardiac output is maintained by four factors: venous return, force of contraction, heart rate, and peripheral resistance. Venous return. Quantity of blood which comes from all over the body to the heart is called venous return. When it increases, then ventricular filling and cardiac output is also increases. It depends upon five factors. First is respiratory pump, a respiratory activity that helps in return of blood to heart during inspiration. During inspiration, thoracic cavity expands, that increases the diameter of inferior vena cava, which results in increased venous return. At the same time, diaphragm goes down and increases the intra-abdominal pressure, which compresses the abdominal vein and pushes the blood upwards towards the heart, resulting in increased venous return. Muscle pump. Muscular activity causes vein compression, and due to presence of balls in veins, blood moves up towards the heart during compression. Gravity. Gravitational force reduces the venous return. In a long-standing person, gravity causes pulling of blood in the legs, which is called venous pulling. Due to pulling, amount of blood returning to heart decreases. Venous pressure. Pressure gradient between veins and greater veins help as driving force for venous return. Sympathetic tone means impulses from vasoconstrictor center through the vasoconstrictor fibers causes constriction of venules, which pushes blood towards the heart. Force of contraction. Cardiac output is directly proportional to the force of contraction. Force of contraction depends on preload and afterload. Preload is the stretching of cardiac muscle fiber at the end of diastole or just before contraction. Stretching of muscle fibers increases their length, which increases the force of contraction and cardiac output. It is like जैसे जितना हम इलास्टिक होगा, इलास्टिक को जितना ज़्यादा स्ट्रेच करेंगे, जितना ज़्यादा खींचेंगे, तो जब उसको हम छोड़ते हैं तो वो उतना ही पावर से और उतना ही स्ट्रेंथ से वापस आता है. तो जितना उसका लेंथ इंक्रीज होगा, उतना ही उसका फोर्स ऑफ कॉन्ट्रैक्शन भी ज़्यादा होगा. तो वैसे जो मसल फाइबर्स हैं, उनमें भी जितना स्ट्रेचिंग ज़्यादा होगी, उतना ही बाद में फोर्स ऑफ कॉन्ट्रैक्शन भी ज़्यादा होगा. तो जो वो स्ट्रेचिंग होता है, उसी को हम प्रीलोड बोलते हैं. आफ्टरलोड. Afterload is the force against which ventricles must contract and eject the blood. Afterload for left ventricle is determined by aortic pressure, and for right ventricle is determined by pulmonary artery pressure. Means afterload वो है कि जो ventricles से blood जहाँ जाना है आगे, उनका जो प्रेशर है वो आफ्टरलोड होगा, क्योंकि उस प्रेशर के लिए पता है कि जो ब्लड है वो ज्यादा प्रेशर से कम प्रेशर की तरफ मूव करता है. तो जो प्रेशर नीचे जो भी आउटा है और राइट वेंट्रिकल में, जैसे जो लेफ्ट वेंट्रिकल है उसमें उससे ब्लड आउटा में जाएगा, जो राइट वेंट्रिकल है उससे पल्मोनरी आर्टरी में जाएगा. तो उन दोनों में जो प्रेशर होगा ब्लड का, उस पर डिपेंड करता है कि हार्ट से ब्लड किस प्रेशर से नीचे जाएगा. तो वो होता है आफ्टरलोड. मतलब जो एओर्टिक प्रेशर और पल्मोनरी आर्टरी प्रेशर है वो डिफाइन करते हैं आफ्टरलोड. Force of contraction of heart and cardiac output are inversely proportional to afterload. Means afterload बढ़ेगा तो cardiac output कम होगा. Means afterload बढ़ना means कि aortic pressure या pulmonary artery pressure बढ़ रहा है. तो जब pressure बढ़ेगा तो जो blood होता है वो ज्यादा pressure से कम pressure की तरफ जाता है. तो यदि एओर्टिक प्रेशर बढ़ेगा और जो उसमें जो वेंट्रिकल्स का प्रेशर है वो थोड़ा यदि उनसे कम हुआ तो ब्लड वेंट्रिकल से एओर्टा में नहीं जाएगा। तो जानने के लिए जरूरी है कि वेंट्रिकल्स का प्रेशर ज्यादा हो और एओर्टा का प्रेशर कम हो। तो जितना ज्यादा एओर्टा का प्रेशर बढ़ेगा तो ब्लड फ्लो कम होगा, ब्लड फ्लो कम होगा तो कार्डियक आउटपुट कम होगा। नेक्स्ट इज हार्ट रेट। कार्डियक आउटपुट इज डायरेक्टली प्रोपोर्शनल टू हार्ट रेट. Peripheral resistance, it is offered to blood flow at the peripheral blood vessels. Cardiac output is inversely proportional to heart rate. Sorry, peripheral resistance. ECG means electrocardiography. It is a technique by which electrical activities of heart are studied. The instrument by which electrical activities are recorded on ECG paper is called electrocardiograph, means ECG machine, or record or graphical presentation of electrical activities of heart is called electrocardiogram. Marking on ECG paper is called Ecg Grid. ECG paper has horizontal and vertical lines at regular interval of 1 mm. Every fifth line is thickened. Time duration of different ECG waves is plotted horizontally on x-axis. Interval between two thick lines मीन्स 5 mm का जो गैप है उसको हम ऐसे अज्यूम करते हैं लाइक 0.2 सेकेंड. इंटरवल बिटवीन टू थिन लाइंस मीन्स 1 mm is equal to 0.04 second. Amplitude of ECG waves is plotted vertically on y-axis. Interval between two thick lines is 0.5 millivolt and between two thin lines is 0.1 millivolt. Speed of machine is equal to 1500 millimeter per second or 25 millimeter per, 1500 millimeter per minute or 25 millimeter per second. Use of ECG. It is useful in determination and diagnosis of heart rate, abnormal electrical conduction, poor blood flow to heart muscle, heart attack, coronary artery diseases, and hypertrophy of heart chambers. ECG is recorded by placing series of electrodes on the surface of the body. These electrodes are called ECG leads. ECG leads are 12, in which 3 are unipolar, 3 are bipolar, and 6 are chest leads. Unipolar leads, which is also called augmented limb leads. In these leads, one electrode is active and another is indifferent electrode. There are 3 types of unipolar leads. AVR, active electrode is connected from right arm. AVL, active electrode is connected from left arm. AVF, active electrode is connected from left leg. And indifferent electrode is connected to another two limbs. Like यदि AVR है तो उसमें एक क्या है राइट आर्म पे, तो जो बचा हुआ एक इंडिफरेंट वाला है लीड है उसे लेफ्ट आर्म या लेफ्ट लेग पे लगाएंगे. Bipolar leads or standard limb leads. In these leads, both electrodes are active. One electrode is positive and another is negative. First lead, second lead, and third lead. First lead, left arm is connected to positive terminal and right arm is connected to negative terminal. Second lead, left leg is connected to positive terminal and right arm is connected to negative terminal. Third lead, left leg is connected to positive terminal and left arm is connected to negative terminal. Chest leads or precordial leads. These are also unipolar leads. Active leads are placed on 6 points over the chest and indifferent lead is connected to any of 3 limbs like left arm, right arm or left leg. Position of chest leads V1, V2, V3, V4, V5 and V6. V1 over right fourth intercostal space near right sternal margin. V2 over left fourth intercostal space near left sternal margin. V3 in between V2 and V4. V4 over left fifth intercostal space on mid-clavicular line. V5 over left fifth intercostal space on anterior axillary line. V6 over left fifth intercostal space on mid-axillary line. Waves of normal electrocardiogram are P wave, Q wave, R wave, S wave, T wave. P wave, it shows atrial activity. Q wave, tiny negative wave appear after P wave and before R wave. R wave, Any positive wave after P wave, it shows ventricular activity. S wave, any negative wave after P wave, it shows ventricular activity. P wave, any wave after S wave, it shows recovery phase of ventricle after contraction. It may be positive or negative. ST segment from the end of S wave to onset of P wave. PR interval from onset of P to onset of Q. QT interval from onset of Q to end of T. QRS complex from onset of Q to end of S. And there are some questions. Different pulse points बताना है. Then different examination of pulse, cardiac output, venous return, ECG, and different ECG leads. Reference books. Thank you.